Let's talk about spring and fall allergies. When we talk about spring and fall allergies, 30% of the population is allergic. And in the spring and the fall, we've got pollen that gets out in the air. And we usually think of runny nose and sneezing and itchy eyes and drive you crazy. When you really look at the allergic reaction, the chemicals that are released from the allergic reaction make people feel poorly. So not only do they itch and sneeze and eyes drive them crazy, but they feel tired. They have malaise. Now, some people in the spring and fall of the year will also get some wheezing. When you breathe in pollen, you just don't breathe it into your nose. The pollen goes all the way down into the lungs where it can cause an allergic reaction in the lungs where the bronchial tree goes into spasm, and also there's inflammation there. So you can get big time wheezing in the spring and the fall that can be very dangerous to your health. So what do you do about it? Well, number one, you need allergy testing to find out what you're allergic to. If it's weeds in the fall, there are 14 or 15 different weeds that can cause problems, and you're not going to know which one unless you have allergy testing. In the spring, it could be tree pollen in the early spring, and there are up to 25 trees that can cause allergy problems. And then there are grasses later on in the spring. So we've got tree pollen, grass pollen, weed pollen that can cause hay fever and can cause asthma. If somebody is having asthma problems, interestingly, if you don't treat the nose, the lungs don't do as well. So treating the entire airway is very important. When we treat the lungs, it's important that you treat the spasm, the bronchospasm, and it's also important that you treat the inflammation. And so you need to talk with your doctor about treating both parts of asthma. Skin testing will tell you what you're allergic to. If you have allergic asthma, if you're a young person with asthma, then the chances are very good that there's underlying allergy, 80% chance. And the studies show that a desensitizing program, that's the allergy shots, make the degree of asthma severity go down over a period of time. The allergy shots improve allergic asthma. The allergy shots improve the allergic nose, tree pollen, grass pollen, weed pollen, dust mite, mold, and animal dander. Immunizing people if they're allergic to those things, and you can only find out by skin testing. There is blood work, not quite as accurate. We call that RAS testing. If you wheeze in the spring and the fall or any time of the year, think about allergies. See your doctor, let your allergist do your skin testing, and talk to you about the best treatment for your nose and your lungs.